Bismillahirrahmanirrahim. Assalamu alaikum rahmatullah. Here we have axial T2 weighted sequence through brain. We can see abnormal increased signals in subcortical white matter in supratentorial compartment, especially along frontoparietal lobes. This can be properly assessed on axial flare sequence. Here we have subcortical white matter in frontoparietal lobes with abnormal increased signals. This patient has uncontrolled diabetes and hypertension, so these are suggestive of microvascular angiopathic changes. Brainstem and cerebellum is unremarkable. There is no hemorrhagic mass lesion. Ventricular chain is normal as well. Here we see there is abnormal signals in left maxillary sinus. We can use T2 weighted sequence. Here it is. We see increased signals and prominent low signal intensity area within it, suggesting high probability of fungal infection, while there is subtle inflammatory changes in left ethmoid air cells which are insignificant. Here we have abnormal soft tissue around medial rectus muscle and posterior most portion of the optic nerve in left orbital apex. We can compare these areas with adjacent right-sided orbit where medial rectus muscle and fat planes around it are clear and sharp with similar changes around optic nerve. But here we see fat planes around medial rectus muscle and optic nerve are indistinct, so there is some abnormality in this region, and we feel that this is extension of left maxillary sinus fungal infection into the orbit. Another area which is abnormal is middle ear on the right side, which is inflamed as well. So in this case we know that patient has uncontrolled hypertension and diabetes. With third nerve palsy, we have fungal left maxillary sinusitis having extension into left orbital apex involving medial rectus muscle and optic nerve. There is associated right-sided otitis media, while flare sequence clearly demonstrates subcortical increased signals in frontoparietal lobes, suggesting microvascular angiopathic changes. Here in this case, we need to see left cavernous sinus because there is some soft tissue thickening. So we need post-contrast examination to rule out involvement of left cavernous sinus. Thank you very much. Assalamu alaikum warahmatullah.